dengue cases have increased, especially I'm talking only about Vasco. The number of cases that we are getting at Cottage Hospital Chicalim have definitely increased these 1 or 2 months. Regarding the kits, what I want to tell you is there are what are called as MEC ELISA kits and rapid kits. These rapid kits, which are used mostly by the privates all over Goa, they are not recognized by the program. There is something called as MEC ELISA kit, which is confirmatory, which we do not have. But what arrangements we have is that moment we suspect that this patient is born to be dengue positive, we send the sample of such patients to Margaon Hospicio, the district hospital for South Goa, and get it confirmed. Now regarding as your question whether it is affecting the treatment of dengue patients, no, it is not affecting, because the moment we suspect a case to be a dengue fever, we presume that it is dengue only, and as if it is confirmed case, we take all the preventive measures, and irrespective of whether the patient is suspected dengue or confirmed dengue, the treatment remains the same. So treatment is given optimally, immediately, on every day basis, day by day basis. From Cottage Hospital Chicalim, the information is sent to Urban Health Center Vasco. And so sanitary inspector Sakalcho and Santo 2 times a day comes. He takes all the suspected cases of dengue, and accordingly preventive measures are being taken. So I don't think that not testing for suspected dengues affecting the patients of dengue cases. The confirmation that comes only after 3 to 4 days, many times after 7 days also. But this is only for the academic purpose. कि कितले cases आले confirmed cases काय कळपा खातीर. But treatment wise, it doesn't make any difference. We are doing our level best.